Hey everyone, today we're diving into a topic that doesn't get much attention but is very important for our health. Today we're talking about Human Metapneumovirus, or HMPV for short. This virus is not as well known as the flu or the common cold, but it can still cause significant health issues. It's a virus that can make you sick, especially kids and older folks. Children under the age of 5 and elderly people are particularly vulnerable to severe symptoms. It's like a cold or the flu, so it's easy to miss. The symptoms can be mild, making it hard to distinguish from other respiratory illnesses. You might get a runny nose, a cough, a sore throat, a fever, or maybe some wheezing. These symptoms can last for several days, and in some cases they can become more severe. Sometimes it can get serious and cause problems like bronchiolitis or pneumonia. These conditions can be particularly dangerous for young children and older adults, leading to hospitalization. HMPV spreads through tiny drops when someone coughs or sneezes. These droplets can travel through the air and infect others who breathe them in. You can also get it by touching stuff that has the virus on it. This includes surfaces like door handles, tables, and even toys that an infected person has touched. There's no shot to prevent HMPV yet, so doctors just help you feel better if you get it. Treatment usually involves managing symptoms such as using fever reducers and staying hydrated. This virus is a problem all over the world, especially at certain times of the year. It tends to be more common in the late winter and early spring, similar to other respiratory viruses. Lots of people end up in the hospital because of it, so it's important to know about it. By being aware of HMPV and its symptoms, we can take steps to protect ourselves and those around us. Right now, China is seeing a lot of HMPV cases, and it's making things tough for hospitals there. The healthcare system is under immense pressure, with medical staff working around the clock to manage the influx of patients. This situation is particularly alarming because it highlights the vulnerabilities in the healthcare infrastructure. Lots of people, especially kids, are getting sick. Pediatric wards are filling up quickly, and parents are understandably worried about their children's health. The virus seems to be affecting younger populations more severely, which adds another layer of concern for families and healthcare providers alike. The people in charge of health in China say it's true. HMPV is spreading fast. Public health announcements are being made regularly to keep the population informed. Officials are urging people to take necessary precautions, such as wearing masks and avoiding crowded places, to help slow the spread of the virus.
They're still figuring out exactly how many people are sick, but hospitals all over China are seeing more and more cases. The situation is evolving rapidly, and healthcare workers are doing their best to keep up with the demand for medical care. Ambulances are constantly arriving at hospitals, bringing in new patients who need immediate attention. This is a big deal because China has so many people, and the virus could spread even more. The dense urban population makes it easier for the virus to transmit from person to person. People are trying to protect themselves by wearing masks, but the sheer number of individuals in close proximity makes it a challenging task. Everyone's worried about whether the hospitals can handle so many sick people. Overcrowded waiting rooms and concerned healthcare workers are a common sight. Medical staff are donning protective gear to safeguard themselves while treating patients, but the strain on resources is evident. The government is trying to fix things, but it shows how important it is to be prepared for these kinds of viruses. Officials are holding press conferences and meetings to coordinate the response. The medical response teams are working tirelessly, but this situation underscores the need for better preparedness and more robust healthcare systems to handle such outbreaks in the future.
China is acting quickly to stop HMPV. They're doing a lot of things to help.
They're doing more testing to see where the virus is spreading. Hospitals are making room for more sick people. They're also telling everyone about HMPV, what it looks like, and how to avoid it. They're reminding people to wash their hands and cover their coughs and sneezes. China is also working with other countries to share information and stop the virus together. They're doing everything they can to protect people.
Section 4. Thinking about the whole world, we need to work together. What's happening in China shows us that viruses can travel anywhere. We're all connected, so a virus in one place can quickly become a problem everywhere. That's why countries need to help each other.
The World Health Organization is keeping an eye on China and helping out. They're also working with other countries to get ready if HMPV shows up there. We all need to work together, share information, and be ready to fight these viruses. This shows us that we need to keep our hospitals strong and work with other countries to stay healthy.
Section 5. Keeping yourself and others safe. There's no shot for HMPV yet, but there are things you can do to stay healthy.
Wash your hands a lot with soap and water for at least 20 seconds. If you don't have soap and water, use hand sanitizer. Stay away from people who are sick, especially if they are coughing or sneezing. Cover your coughs and sneezes with a tissue or your elbow. Clean things that people touch a lot, like doorknobs and light switches. If you or your child feels sick, go see a doctor. It's important to catch it early so it doesn't get worse and spread to others.
Section 6. HMPV and the world. Why public health matters. What's happening in China shows us that we're all connected when it comes to health. Viruses can spread quickly all over the world, which is a big problem for everyone.
This means we all need to work together to fight new viruses. Countries need to share information and make sure hospitals are ready. HMPV shows us how important it is to know about public health and be prepared. Everyone needs to do their part to stay healthy and protect others.
Section 7. Staying alert and knowing what's going on. Our best defense. In a world where information is at our fingertips, staying informed is crucial. It's not just about knowing the latest headlines, but understanding the implications of what's happening around us. In today's world, the best way to fight viruses like HMPV is to stay alert and know what's happening. This means regularly checking reliable sources for updates and being aware of any new health advisories or guidelines.
Keep up with news about health, whether it's through your smartphone, television, or newspapers. Staying updated helps you make informed decisions about your health and safety. Do the things that keep you healthy, like exercising regularly, eating a balanced diet, and maintaining good hygiene. These habits strengthen your immune system and make you more resilient against illnesses. And see a doctor if you feel sick. Early detection and treatment can prevent the spread of viruses and protect those around you. Regular checkups are also important for maintaining overall health. By caring about public health, learning more about viruses, and working together, we can create a safer environment for everyone. Community efforts and shared knowledge are powerful tools in combating health threats. We can fight these viruses and make the world a healthier place. Scientists, health workers, and everyday people all play a role in this collective effort. Every action counts, no matter how small. Remember, knowing what's going on is important. By staying informed, doing our part, and working together, we can build a community that is well prepared to face any health challenge. We can beat these viruses and have a healthier future. Together, through vigilance, education, and cooperation, we can ensure a safer and healthier world for ourselves and future generations.